Hello, and thank you for the opportunity to present. This is work done with my advisor, Dr. Arnold, who unfortunately got called into surgery this morning, and I don't believe he is here yet. There we go. So I'll skip over the introduction a little bit because it's very similar to what Dr. Pinter just presented. But this is also a part of the TOPS study, which again is a facet arthroplasty device. And this study in particular focuses on the older versus younger adults. So I'll get into that now. So as for our methods, this is a sub-analysis of the FDA trial where following the randomization, patients were stratified by age, with 65 years being the cutoff for younger versus older adults. And we look particularly at this difference. On the left here is just an example of the device implanted in a patient, and then on the right is the baseline differences between the groups overall. As you can see, there is no significant difference in operative time, blood loss, or length of stay, and nearly all patients were operated on at L4, L5. For patient-reported outcomes, looking at older versus younger, so our older groups are in the gray and yellow, and our younger groups are in the blue and orange. Looking on the left is the improvement of at least 15 points on the ODI, which was the MCID for this group. You can see that only in the younger patients at 2 years was there a significant difference between the two, between T-LIF and TOPS device. And then on the right is the VAS score for low back with an improvement of at least 20 points. And only at 6 weeks and 2 years, we see a significant difference between the TOPS young and T-LIF young, with TOPS having significantly more patients meeting that outcome. Similar things were seen for the ZCQ score. Only in the younger group was there a significantly higher percentage of all patients achieving MCID in all categories. Further, looking at the motion preservation, you can see that the TOPS groups preserve significantly more motion in comparison to the T-LIF groups, and this was significant for both the younger and older TOPS patients, as shown here. Looking similarly at the clinical composite that Dr. Pinter presented at 2 years, we see a significant difference in the ODI reduction and no new or worsening neurological deficit in the TOPS young patients compared to the T-LIF young patients. No differences were seen in the older groups. Overall, as conclusions, we find that TOPS performs equally or better than T-LIF for patient-reported outcomes, both in our younger and our older patients. The differences in the patient-reported outcomes were more evident in the younger patients. However, both groups improved significantly from baseline. The primary limitations of the study were that this is a sub-analysis, and also that not all patients have reported outcomes due to the follow-up nature of the study and it being an interim analysis. And also we haven't had enough time to see effects of adjacent segment disease and see how that compares in younger versus older patients. I'd like to thank my advisor and our co-authors and all the participating centers, and thank you for your time today.